Hey everyone, today we're diving into the sharp rise in flu cases across Japan. It's really becoming a serious issue.
Yeah, definitely. Absolutely, it's pretty alarming.
It
What's the
is.
latest data showing on this?
Well, the health ministry released data showing that from December 9th to 15th, there were 94,259 flu cases reported across about 5,000 hospitals and clinics nationwide.
Wow,
That's a massive jump from the previous week.
that's incredible. So what's the
Right.
estimated total of cases nationwide?
The estimated total is 718,000 cases, more than double the number from the previous week. The national average of reported cases per medical institution jumped to 19.06 from 9.03.
So all prefectures are seeing increases then?
Exactly. Yes, all 47 prefectures saw increases. Oita is leading with 37.22 cases per medical
Wow.
facility, then Fukuoka at 3540, Kagoshima at 29.0, Ehime at 2890, and Saga at 2855. Oita and Fukuoka have even surpassed the warning threshold of 30 cases per institution.
And Tokyo? How's the situation there?
Well, Tokyo's situation is also concerning. They've recorded 17.36 cases per medical facility as of December 15th,
Really?
which is a sharp increase from 819 the week before. This breaches the city's advisory threshold of 10, signaling a high likelihood of a large-scale outbreak within the next 4 weeks.
That's really concerning.
It is.
I heard even the imperial household has been affected.
Yes, Princess Aiko has contracted the virus and is expected to remain absent from official duties until at least Friday.
Oh no.
It's a clear sign that this outbreak is widespread.
What's happening with schools and care facilities then? Are
Well-
they seeing outbreaks too?
Yes, outbreaks there are intensifying. In Tokyo, cluster outbreaks doubled to 211 from December 9th to 15th compared
That's
to the week
significant.
before. Nationwide, 2,759 schools and other institutions implemented partial or full closures during that period, which is twice the previous week's total.
That's huge. Hospitalizations must be increasing as well.
Absolutely. Exactly, they've risen significantly. 1,316 patients nationwide were admitted for influenza in the same period, up from 628. Of these, 58 required intensive care, up from 43.
So with flu cases rising and COVID-19 cases also increasing, the healthcare system must be under a lot of strain.
Yes, absolutely. Officials are concerned about potential burdens on the healthcare system.
Right.
The combination of flu and COVID-19 cases is definitely putting pressure on hospitals.
Do experts have any insights on why we're seeing such a sharp rise in flu cases now?
Well, according to Tadashi Ishida of the Japanese Association for Infectious Diseases, we can expect high case counts because people were less exposed to the flu virus during the pandemic and so lack immunity.
I see.
It's like our immune systems haven't had their usual workout.
That makes sense. But didn't we have an unusual flu season earlier?
Yes. Dr. Norio Sugaya noted that flu cases began surging unusually early in September 2023,
Right.
with waves continuing into May 2024. During that period, an estimated 18 million people were infected, which is 1.8 times the usual number.
Wait, but I thought flu seasons typically peak in January?
You're right. Before COVID-19, flu cases usually peaked in January, but the pandemic altered patterns due to stringent measures that suppressed influenza outbreaks.
So now that restrictions are lifted, we're seeing a return to pre-pandemic patterns?
Exactly. Both Ishida and Sugaya expect cases to peak in January, which aligns with current data.
Yeah.
It's almost like the flu is catching up.
That's a bit worrisome. What are health officials recommending to the public?
Well, they're urging everyone to adopt rigorous preventive measures, like regular hand washing, using hand sanitizers, and practicing proper cough etiquette.
Right.
Vaccination remains the most effective way to prevent severe flu symptoms, especially among vulnerable groups.
Speaking of vaccinations, are people getting vaccinated in sufficient numbers?
That's a good question. Officials are pushing for higher vaccination rates. It's important for people to get vaccinated promptly to help curb the spread.
You know, I think with the focus on COVID-19, some people might have overlooked getting their flu shots this year.
Possibly. That's possible. With so much attention on COVID-19, the flu might have slipped under the radar for some.
Yeah,
It's important to remember that the flu can also be serious.
definitely. But don't you think constantly emphasizing precautions might lead to fatigue? People might just tune it out.
I see your point. That's a fair point. Precaution fatigue is real. But given the rising cases, it's crucial we keep reminding people.
I suppose.
Maybe new strategies are needed to engage the public.
Absolutely. Creative approaches could make a difference.
Yeah. Perhaps community initiatives or educational campaigns can help reinforce the message.
Right.
After all, fighting the flu is a collective effort.
Well, let's hope with increased awareness and preventive actions, we can mitigate the impact of this flu season.
Definitely. In the meantime, everyone should stay vigilant and take care of their health.